day, everyone. Welcome to Your Health Today with Dr. Yide. I am Dr. Olaide Chinodu. I'd like to thank everyone who posted their comments the last time and liked the videos. God bless you all. Now, today we'll be talking about something we call hemorrhoids, commonly known as JD. Now, what are hemorrhoids? Well, in layman terms, hemorrhoids are swellings, when the veins or the blood vessels within your anus, the anal region, gets engorged, and most likely starts to bleed. That's it for a layman. How common are hemorrhoids? Yeah, they're quite common. Now let's go straight to the etiology, the cause. Now, I can remember while we were younger, we were taught that when you take a lot of sugar or sugary stuff, it makes you have JD. Well, that's not completely wrong. Anyway, as we discuss the causes, you would understand where that came from. Now, anything that can cause increased intra-abdominal pressure, anything that can increase the pressure within your abdomen can actually cause that. Okay, and what are examples? Okay, first things first, when you have a lot of constipation, you're trying to pass out to your straining. Imagine doing that over and over and over again. It's a matter of time. The veins in the anal region will start to complain and they start to engorge, and it can start that way. Another one is diarrhea. Imagine someone who has diarrhea. That's passage of watery stool about 3 or 4 times a day, with or without blood. Diarrhea, rush, you going in and out of the toilet, using the anus every now and then can also cause that too. Then also pregnant women, even before labor, pregnant women are prone to hemorrhoids as well. Constipation is a very common thing in pregnancy. Then some liver diseases, hepatic varices and so that can also lead to that. Portal hypertension can lead to that. Now, we just mentioned the causes. Now, there are other things called risk factors, things that can actually make you prone or more prone to it. When I said constipation, I forgot to mention that one major thing that can lead to constipation is your diet. When you eat a lot of low fiber diets, it can actually lead to constipation, because fiber is what you need to create bulk. It's bulk forming. It makes the colon, the large intestine, the rectum distend to excite the defecation reflex. That's the reflex that makes you want to go. Okay, so when you take low fiber diets, your stool starts to stack upon itself, stack till it's big enough to come out, causing constipation. All right, hope I was as basic. I'm trying to be as basic as much as possible. Now, things that can make you risk factors that can make you prone to hemorrhoids are familial tendencies, meaning if you if your mom or your parents or somebody in the family has this, there's a tendency that you might have it. Some chronic diarrhea, like I mentioned earlier, some colon malignancies, colon cancer. When we say colon, we're talking about the large intestine. Okay, obesity, obesity can cause it. I mentioned liver diseases here. Some loss of anal muscle tones. If you indulge in anal sex, you are prone to having hemorrhoids, JD, and also some inflammatory bowel disease. Now let's talk about the types of JD, so to speak, of hemorrhoids. When you look at the anatomy of the anus, we have a dented line, a line not really visible and all that, that separates the two types of hemorrhoids we're going to talk about. There's the internal hemorrhoid and there's the external hemorrhoid. Now, the internal hemorrhoid is usually painless because it's above the dented line. there are really no nerves, that no somatic nerves. Somatic means body nerves that supply that part, but the external one, very painful, you know. All right, so those are the two basic types. What are the differential diagnoses? What are the things, you know? Because everyone says, I have pile, I have pile, I have pile. Not everything is pile, you know. You need to see a professional, a medical doctor, to make that diagnosis for you, you know, right? But I just like to talk about basic treatments. Now, we could treat conservatively or surgically. Now, when we say conservatively, we're talking about the use of drugs or some basic remedies. Now, excuse me, we've spoken about the things, the likely causes. If somebody's been feeding on or been eating low fiber diets, if he starts to take high fiber diets, yeah, it will resolve. Okay, you know, you have to give some things like maybe anusol or some things to just lubricate the anus, to make that place less sore, to resolve the inflammation as well. You know, if this patient has diarrhea frequently, give things to prevent diarrhea. It's basic, you know. Another method is surgery. You know, you could just have an hemorrhoidectomy, but before you get an hemorrhoidectomy, you must be sure that other methods have proved abortive, so to speak. Now, like I said earlier, other things um it could be a fissure in anal, a fistula, an abnormal communication between membranes and all that. It could be rectal prolapse, it could be abscess, you know, gluteal abscess, or even anal abscess, you know, funny things, you know. It doesn't have to be hemorrhoid, so you need a professional to look at it to make a diagnosis. Now, the essence of this video is to disabuse our minds of a lot of things that are not really true. So I hope I've been able to do justice. So please post your comments. If you have questions, please, I would love to answer your questions. Please like this video and don't forget to subscribe to my YouTube channel. Thank you very much. Bye bye.